Hello everyone, welcome back. Today I'll be covering prognostic factor in osteosarcoma, usually asked in BAQ or short notes during my final year exam. I hope it helps. Now let's get started. Based on Zhao Zhang et al. 2023, based on their study of 203 patients, the 5-year survival rate was 70%. Performance of surgery was associated with better survival outcome. Since 1970s, the introduction of chemotherapy significantly improved the survival of osteosarcoma patients. In a recent meta-analysis, patients after limb salvage surgery achieved better 5-year survival rate than the patients after amputation with neoadjuvant chemotherapy. Thus, the salvage surgery has become the first choice for eligible patients. Chemotherapy and good tumor necrosis is important in the treatment of osteosarcoma patients. Chemotherapy showed significant correlation with the long-term survival in osteosarcoma. The EURAMOS-1 study reported that those patients who had a poor histological response to neoadjuvant chemotherapy were associated with worse survival outcome after surgery. As reported, the patient with lung metastasis showed poor survival. Specifically, patient with lung metastasis has a 2.34-fold higher risk of death compared to those without lung metastasis. The best modality for diagnosing lung metastasis is PET-CT with high sensitivity around 90%. Thus, risk evaluation on metastasis in osteosarcoma at diagnosis and during later course is important. Additional notes. How to determine the risk of lung metastasis for osteosarcoma patient. Study shows the large tumor size has or was associated with higher odds of lung metastasis. Patients with tumor size larger than 371 cm power of 3 showed a probability of 69% to suffer lung metastasis compared with 34% in those with smaller tumor size. Axial location, tumor size more than 10 cm, higher end stage, and bone metastasis presence reported to be significant risk factor of lung metastasis in osteosarcoma. Higher end stage means the higher lymph node involvement. Pulmonary metastatic lesion. The treatment of pulmonary metastatic lesion showed significant effect on the improved survival of osteosarcoma patients. For osteosarcoma patients with resectable lung metastasis, the NCCN guidelines recommended wide excision of the primary tumor and preoperative chemotherapy should be performed. Meanwhile, pulmonary metastasectomy should be under the consideration in selected cases. It was reported that patients with less lesion, unilateral lung disease, and patients after metastasectomy showed improved survival. For T3 stage and the presence of bone metastasis were risk factor for synchronous lung metastasis. Most of the lung metastasis happen in the first 2 or 3 years. Thus, lung CT should be scheduled with high frequency in the first 2 years. The presence of bone metastasis, bad necrosis rate, elevated Ki-67, and elevated LDH were risk factors associated with higher odds of metachronous lung metastasis. Prognostic factor for osteosarcoma patient are, please pay attention. A. Gender. Male patients worse than female. B. Age at the time of diagnosis. Older patients more than 40 years old are associated with worse osteosarcoma compared to the younger age. It might be due to the comorbidities. C. Tumor size. Big size associated with higher tumor burden. D. Tumor location. Osteosarcoma of the extremities have a better survival rate than the axial osteosarcoma. But this is controversial. E. Histological subtypes. F. Histological response to chemotherapy. G. Surgery. Limb salvage are better than amputation. In summary, poor prognosis for osteosarcoma patients are 1. Male gender, 2. Older age, 3. Large tumor size, 4. Non-extremity osteosarcoma, 5. Proximal osteosarcoma, 6. Poor histological response to chemotherapy, that means less than 90% necrosis, 7. No surgical treatment, 8. Amputation surgery. We have reached to the end of this video. I hope it helps. See you in the next one. Take care and bye.